Hey guys, today I want to talk about tuberculosis, which again is a major disease that can pop up anytime in your NCLEX exam. So, simply, tuberculosis, or what we call TB, is a disease caused by the bacteria called mycobacterium, right? And that's essential to know for your NCLEX exam, okay? Now, the bacteria usually attacks the lungs, and when this happens, we call that pulmonary tuberculosis, okay? And it's an airborne infection. That's important to know for the NCLEX, and it's communicable, and it can occur acutely or chronically. So, what is going on in our patient? So basically, during a pulmonary tuberculosis, right, the alveoli becomes the focus of infection from the inhaled droplets that contains the bacteria, right? And the tuberculous bacilli, which is the mycobacterium, would then multiply and it would spread to the lymphatics in the body, and eventually it drains itself into the systemic circulation of the body, right? And as a result of this, when we assess our patients with tuberculosis, we would see that they would be fatigue, they would be malaise, there would also be signs of irritability, right, night sweats, and also our patient would have tachycardia, and we have to take note of that because that could be serious. Now, why is our patient tachycardic, right? A quick simple explanation would be the fact that due to the growing infection in the lungs of our patients, right, and eventually the entire respiratory system would be compromised and would not be working at full capacity. And this can eventually lead to shortness of breath, right? And also tachycardia, which is rapid heartbeat, right? Or rapid heart rate. Now, since our respiratory exchange system is impaired and therefore shortened, right? The blood simply doesn't get sufficient oxygenation, and because due to this deficiency, it causes our patient to be tachycardic because the rapid heart rate is a sign of compensation, so it needs to compensate for the low oxygenation of blood. Okay? I hope that somewhat made a little bit of sense. Now, who mostly gets this infection? Usually people living in crowded conditions and living areas, and especially those with compromised immune systems are the ones that are at risk. Okay? Now, how do we diagnose our patient? Now, there are basically two common diagnostic tests that you need to be familiar with for your exam, and that's the Mantle skin test, which is what we also call purified protein derivative, or PPD, which is what most of you guys, nursing students, had to get from your clinic since it's a prerequisite before being able to do your clinicals, right? And the other diagnostic exam involves the smear and culture test, which basically involves having a sterile sputum specimen. Okay, now with the PPD, or the Mantle skin test, you as the nurse would check the site within 48 to 72 hours, right? And an area of induration, or the bump, measuring 10 millimeters or more in diameter, is basically an indicator of the patient having tuberculosis, and therefore further tests will then have to be conducted. Okay, while if we have a patient with HIV, right, the induration of more than 5 millimeters in our HIV patient would mean an exposure to tuberculosis. Okay, so why the difference of size in the HIV patient? Let me explain simply. Now, due to the immunosuppression of the patient with HIV, it results in what we call cellular hypersensitivity, right, with the T lymphocytes, and the degree of suppression can usually reflect a patient's inability to respond normally, right, to skin test antigens such as the one with the PPD. Okay, so please take note of that for your exam. On the next few videos, I will go over the important pharmacological drugs that you need to know in order to treat your patient with TB, specifically rifampin, isoniazid, and pyrazinamide. Okay? Now, that's it for now. Again, thank you so much, guys, for spending your time with me. I really do appreciate it, knowing that you have learned something that can help you pass your NCLEX exam. And if you do feel that you want to help support me with continuing doing all these NCLEX videos, just please visit my website at www.allnursingnotes.com, and there's an NCLEX course that is available over there that has helped thousands of NCLEX takers pass their exam. Again, thank you so much, guys. Good luck in your exams. Good luck and God bless. Thank you.